Dr. Afifur Rahman, I bring in all your greetings and wishes from all the faculty members of Speed Medical Institute to you for a fantastic and extraordinary performance in NEET SS 2021 in the specialty of DM Cardiology.
Thank you, sir.
Excellent. And can we know a background medical career so far from MBBS to MD to DM Cardiology about
Yes, sir.
Dr. Afifur?
Yes, sir. I have initiated my journey in 2007. I have done my MBBS and MD both from Medical College, Kolkata. I am from Kolkata till 2013 and then 13 to 16. So I have completed my MD in 2016. Then I have done my DNB in medicine and MRCP in UK and Ireland. I have completed. Then actually I have dropped my idea of doing a super specialty. I was practicing as an internal medicine and was quite happy. But then I decided after so long time to go for it.
So, to do DM cardiology was right from MBBS days?
Yes, sir. I was pretty much fond of cardiology. Actually, I love it. In these 6 years also, I have practiced cardiology, mostly in the field of cardiology. Some non-invasive and some invasive interventions I have done. But all the way, I have found that ultimately I need a qualification proper to carry it forward. And as I love it, so this is the best time I thought to give it a try.
So, once you decide to go on, and what did you do?
Sir, I was not in touch with the study for last 6 years. So it was very difficult for me to come in the mainstream. And the patterns are also changed from my days. I have learned about the Speed Institute from my colleagues because they know the subject and they teaches us very well. And in this short span of time, it is really not possible to go through all those aspects of the subject. By this platform actually helped us a lot to do it.
So, you joined Speed.
Yes, sir, I have joined Speed.
So, when was that? When you start and how? When you started and how you started preparing with that? How many hours you used to spend? Because you said you are practicing now, and how much time you could dedicate for that, and how long you did it? Can you say something on that?
Yes, sir, it was very difficult to balance initially. I have taken it seriously for last 6 months. I have to reduce my practice a little bit in the morning. I used to see the videos few hours, and after coming back to home also I have to see I used to see the videos. In that way I managed, and last 1 month I have given much more time in all these videos.
So, were you able to cover all the sessions in the?
No, sir, it is really not possible. I could not finish all the videos, but Karthikeyan sir's videos I have finished, all the internal medicine videos, because in between there was a controversial thing that questions will be in the exit level. Then I dropped the idea of seeing the in-depth videos of the respective core subjects. But then again, they said that it will be like the old patterns, but I was not able to finish all those videos.
What about reading books?
Sir, personally, I never read the book in these 6 months because this is a very short span of time, and actually all those specialty books are for practicing doctors actually, or those who have passed. It is very difficult to inculcate all those things and understand and reproduce. So it is better to learn from a person who knows the subject, from a teacher, having experience of teaching students and having knowledge of the questions coming all these days. So that is the main idea of taking the Speed and all these apps.
So, the entire resource and management was managed through the videos and the questions in the app.
Yes, sir. Entirely, I am based on the videos only.
So, that was translated to rank number 3. Is what you want to say?
I couldn't believe, sir. I have maybe to some extent underestimated myself. I should have given the INISS also, but I forgot to give that thing. So I missed the bus actually. After giving this exam, I know that I should have done that thing. Maybe that will be helpful also, because this year INI question was, I think cardiac portion was more easier as compared to the NEET SS pattern this year.
Yes, exactly. So, what do you want to? What is your message to your aspirants of DM cardiology, or your juniors, or your friends who wants to aspire for that?
Sir, I just want to say that you cannot read all the things in a span of this short 1 year or maybe 6 months. You need someone who knows the subject, who knows how to teach it, and you need a platform where all the informations are given in a very concise pattern, and you can revise all these things. So this app-based learning is very, very important, and revising these things repeatedly, that is the key of success.
So, I mean, you say that it's enough that going through this speed is enough to crack.
Mostly, sir, the cardiac portion, Azim sir has in depth dealt. Uh, that much cannot be remembered. And maybe certain updates are coming after loading this video. Those things has to be incorporated, like latest gold guidelines or GINA guidelines, or some cardiac guidelines regarding heart failure with preserved ejection fractions, like that. So those things need to be added. Otherwise, sir, the videos are enough, I think, more than enough.
Okay. Now, a juncture to thank who helped you to build your career so far, whom all you want to thank, kindly you can go ahead.
Sir, I am very thankful to Almighty, first of all, for giving me this enthusiasm to turn into a reality. I can now do it, what I have dreamed before. And second thing is, sir, my family members have supported me a lot, because I have a small kid. He actually loves me a lot, so they has to control him, and they give me the opportunity to study after all these things. And sir, of course, the learning platform of the speed. Actually, this is a ladder kind of thing. I was lost completely after having no study for 6 years. Only I have practiced. So in that way, it is successful.
Doctor, it was a very elaborate discussion on your journey to reach your destiny of cardiology, and we wish you all the very best, all the success for all your future endeavors in the specialty of DM cardiology. Keep going.
Sir, I just want to only ask one thing. Sir, any suggestion for the selection of the colleges?
Yes, doctor, we have a session for that, and definitely we will discuss in a forum, and we will have a elaborate discussion on that.
Thank you, sir. Thank you.
And definitely we have arranged, and the date will be intimated to you.
Okay, sir. Thank you.
Okay.
Your speeches were very inspirational, sir. Last time I have seen your speech before this exam, I was not able to finish all those things that you have told to do, but even 50% of doing that thing is enough, I think.
Great. Great. Thanks for good words and encouragement. And once again, I wish you all the best and all the success for a great career and endeavor in DM cardiology, and your contribution to the specialty will be enormous. And the patients are going to get benefited out of your services. And that is also going to be a great factor. And I wish you all the best and all the success for all your endeavors from now on.